So treatment depends on what type of incontinence you have, so that's the first important step to answer. Let's talk first about treatments for urge incontinence. Remember, it's a muscle spasm. If you had a spasm in your back, we'd place you on backrest and give you medication. Same thing with your bladder. The trouble is we can't tell you to quit using your bladder for 2 or 3 days and give it a rest. So it's very important to avoid the things that irritate it. The list isn't a fun one: coffee, even decaf, tea, alcohol, carbonation, artificial sweeteners, caffeine, or all things that irritate that muscle. It leaves you pretty much with water or clear fruit juices that you can see through, such as apple juice or cranberry juice. There is a medication we use to relax that bladder, and physical therapy can help retrain that muscle through timed voiding to help you learn how to relax it. Stress incontinence is treated slightly differently. That's, remember, a problem with the exit tube. We need to help you kink that off or hold it shut tighter so that when you place a stress against it, it can remain closed. There's multiple ways to provide that support. Physical therapy can help with exercises to help squeeze shut that exit tube. A device can be placed inside the vagina called a pessary. It's very similar to a diaphragm. It pushes up from underneath and kinks off the urethra. We encourage you to avoid excess fluid intake. Unfortunately, the 8 glasses of water a day was the worst thing perpetuated on women with stress incontinence. You only need 60 to 80 ounces of liquid a day, and what goes in comes out, so you don't want to give extra fluid in order for that urethra to have to try and hold shut. We also have surgery options that can help, slings that can go underneath the urethra and provide additional support in order to help keep a kink there and keep the urethra closed.